I'd like to welcome Heather MacDonald. And Heather is the medical director of the Hoag Breast and Ovarian Cancer Prevention Center. I'd like to welcome you formally here, but you were telling me you were here a couple years ago, you think?
Thank you.
Right?
I think I was.
Yeah, I think you were too. Well, great to have you back. And what we're talking about today are really risk factors for breast cancer. And the risk factors can vary from your family history to maybe your diet, all kinds of things. And sometimes maybe it's to the point where you have very little of those risk factors, but unfortunately you may still get some form of breast cancer, right?
Yes, that's true. And unfortunately, most breast cancer is unexplained, meaning we can't. The number one question people ask me is, why did this happen to me? And unfortunately, that's often the question I don't have an answer for. But there are things that we know from large population studies that can either be protective or put you at risk. For example, women who have a first child under the age of 30 tend to have a lower risk of breast cancer than women who had their first child over the age of 30. If you looked at 1,000 women...
Their first child?
Their first child.
So if they have their second or third child over 30, it's less of a risk factor?
No, if you get pregnant as a woman before the age of 30, your risk goes down. You can have 12 children after the age of 30 and not impact your breast cancer risk. But there's something about that first pregnancy.
Wow.
Actually, what we think it is as a woman matures, her breast tissue doesn't undergo its final stage of development until she's pregnant. And it takes that final step to start producing milk.
Very interesting.
Until your first pregnancy, it's sort of in some kind of quiescent state. And there's something about taking that last step of development before the age of 30 that seems to be protective about breast cancer.
Now, have you noticed this, or I should say studies, because of course, years ago, decades ago, it was very common for women to have children. They got married earlier, and they had children sometimes at age 20, 22, but usually in their early to mid 20s was common. Now, it's almost uncommon. Most women, most folks or families are being started in their after age 30, sometimes even after age 40.
So we are watching the demographics change of family structure, although the average age of first pregnancy still hovers around 28. So we haven't quite seen, we can't explain sort of an increased rate of breast cancer by this particular factor.
But it's interesting.
It's one that comes up, and when a doctor evaluates your breast cancer risk, it's one of the factors we look at. Other factors we look at, women who had earlier first menstrual period and later menopause, sort of a length of that reproductive life impacts your breast cancer risk. Again, these are things that either you can't change, or I'm never going to tell a 22-year-old woman to have a baby to try and prevent breast cancer. The risk factors that are under our control are mostly lifestyle. And it all sounds like common sense, but here's one more reason to do the things that we know that we should be doing. So exercise, a limited animal fat diet, maintaining a healthy weight, moderate alcohol use. There was a major study that looked at those factors, and those factors reduce breast cancer risk by 1/3. So there are things we all know we should be doing, and yet they can have a profound impact on our sort of overarching well-being as well as our cancer risk.
Now, of course, family history, right?
Yes.
And when you look at family history, is it specifically looking at the line of women who had breast cancer, or cancer in general running through your family, from your dad, from your mom, whatever it might be?
I'm glad that you asked that, because it's a common misunderstanding, even among physicians, that it's really only mother's family history that impacts your breast cancer risk. And I think it feels a little intuitive. Your father, most men don't get breast cancer. Breast and ovarian cancers run together. Men don't have ovaries. So it's kind of intuitive to focus on the mother's family history. But these cancer-related genes can come from either side. So most of the genes that we know are linked to breast and ovarian cancer are part of our natural defense system to protect our DNA from damage. So our DNA is the genetic information in each one of our cells, the blueprint that makes you look like you and me look like me. You get half of that information from your mother, half of that information from your father. If you inherit a gene that doesn't function from either parent, you're at risk for cancer. And it's because the damage builds up in your DNA until a cell can transform from a normal cell into this cancer cell, which grows uncontrollably. That predisposition can come from either side of the family. It is true that even the male family members who carry these genes don't have the same elevated risk as cancer that women do, but it means it's more likely they can be a silent carrier. So for example, in your father's family, if your grandmother had cancer young, I still find that concerning, even though it's your father's mother instead of your mother's mother, because there's a chance your father could have inherited one of these genes from his mother, then pass it on to you, but he is less likely to get cancer and kind of demonstrate that he has that gene. So we do need to pay attention to both sides. The cancer risks aren't additive.
Interesting,
So if you have one aunt on one side, a father's sister, and one aunt who's a mother's sister, that kind of doesn't count as two aunts, because unless your mother and your father are related to each other, and then that's a whole separate conversation.
That's a whole different thing.
But the two sides of the family don't sort of add to each other, but they both need to be looked at.
Let me ask you this, because looking at your title here, breast and ovarian cancer, there is the preventative vaccine that usually is given to younger girls or in their early teens, and I forget the name of it.
It's the human papillomavirus vaccine, or
and
HPV.
That's for ovarian cancer, am I right?
That's for cervical cancer.
Okay, cervical. So there is a vaccine out there for that.
Yes.
Do you anticipate a time when you're looking at one for breast cancer, or is it because it manifests so differently that might be much harder to target?
That's an excellent question. We know that over 95% of cervical cancer is caused by a virus. And it's the human papillomavirus. It's very common in our population. It's well addressed with a vaccine.
And that's because it starts as a virus?
Because it starts as an infection. Breast and ovarian cancer both do not start as an infection. Although, similar to, so our cervical cancer story in some ways is a success story. We have an excellent screening tool being the pap smear. And for example, in our country, when pap smears became widely used, the rates of cervical cancer plummeted. Then the vaccine comes along, and now hopefully we prevent our girls. The pap smear can pick it up early. Now we're just going to prevent our girls ever from getting it. For breast cancer, we have a similar-ish success story in that the mammogram is an incredibly effective screening tool. That mammograms do save lives. It is that simple. That cancer, when it's found on a mammogram where the patient can't feel it, I can't feel it, it's just some tiny little 8mm thing, that is rarely a fatal event. When breast cancer is caught that early, and a mammogram works really well. So here's my pitch, please everybody get your mammogram. Because it's not an infection, it doesn't, there's not sort of an inroad with a vaccine. Ovarian cancer doesn't lend itself to being screened for. We don't, so for example, a breast cancer, by the time you could feel a breast cancer, it's probably been there for 7 years. I mean, it literally sits there and waits, most of it, for us to find it. Whereas ovarian cancer, we think, develops within a matter of months. It's a much more, it's a different and more aggressive disease. And that's why we have no screening test. You have the pap smear for cervical cancer, you have the mammogram for breast cancer. We have no screening test for ovarian cancer because it doesn't lend itself. It doesn't wait for us to find it, basically.
One day, I know the topic here is breast cancer. Maybe one day you come back and talk about ovarian cancer. How do you get checked for that? And
we could, absolutely.
All right, that would be great.
But it's October. We'll focus on breast cancer.
Yes, exactly. Well, I want to give you the website and the phone number. And it's 949-764-7235 or hoag.org/high-risk, as you see right there on the screen. And I want to thank you, Heather, for coming on.
Thank you
Great
so
information.
Much. Thank you, sir.
I'm sure we'll see you again.
Great.
Take care. We'll be right back.